I personally feel that the message why Dr. Sharan is doing this effort and making this series or this, film, whatever you may call it, this exercise, he is doing it so that he has been in his life a very, upfront, a doctor with great morals, a doctor with a good conscience. For him, the patient has always come first, and the money has come later. Like if a surgery is costing 20 lakhs, so he's not going to charge straight away 20 lakhs. He'll try to bring the price down, the cost down to maybe 2 lakhs or 3 lakhs, and so that the surgery can be done, can be afforded by the patient. You know. But in the process, he's ruffling a lot of feathers. He's hurting a lot of people, a lot of vested interest people who always have this kind of a agenda that they push doctors to increase the cost so that their equipment, their medicines can be sold, and they remain into business, and that's how I'll call it maybe if I'm not wrong, some kind of a medical mafia. If I'm not wrong, I'll use this term because that's how. That's what Dr. Sharan is trying to fight, according to me, in this series, Medical Mafia. I think it has been fantastic. I never knew that I will have to play such a serious doctor with such technical dialogues and with such, which have all the lines have to be delivered with a lot of finesse because, after doing a real life story on Dr. Sharan Srinivasan, who is a neurosurgeon. And what I am playing in this series is Dr. Albert, who was one of his mentors and who looked after him, and almost under his guidance, Dr. Sharan grew to great heights. So I'm glad to play this role of Dr. Albert, and it's really a wonderful experience. I've never done such a role with I played doctor earlier many times, but more in a comical zone than in a very serious and very professional zone where everything has to be prim and proper and the lines have to be meticulously properly delivered. No, I knew it will be something unique just for a reason that it's ultimately a real life story. And I'm glad that Dr. Sharan is always around when I'm performing. So there is always some kind of he keeps on encouraging me, that okay, I'm doing well, I've done well, I've delivered the lines correct. Because the lines are, the technical terms are very tough for an actor, like who is not into this kind of a medical zone, to remember and then to deliver and then also deliver convincingly, as a part of conversation. Yeah, but there are many fond incidents. Of course, I have met so many. Just now, 5 minutes back, I met a patient, a young girl, maybe around 23, 24 years old, who was just going for an MBA and to get a seat into MBA, and she developed some migraine, and then nobody tested her properly. That's what Dr. Sharan says, that we don't do proper diagnosis and we just take shortcuts. The doctors, So we diagnosed, and it was a very major brain issue, and the brain surgery had to be conducted. Dr. Sharan conducted, and now that girl is all right. I just met her. She's smiling and she's going ahead with her life. It's a great thing.